Yes, men and weight loss surgery is an interesting question. If you look at centres of excellence around the world, including ours, about 85% of patients presenting themselves for surgical weight loss are women, only about 15% are men. And we can speculate about why that might be. I think there's no doubt that social pressures on women are much greater than they are on men to conform to a certain physical type. I think that's probably changing because I think men are becoming much more self-aware than they have been historically. So we are beginning to see more men come as candidates for surgery, and that's actually quite important because men tend to carry their weight around their middle. We call this visceral fat. And of course this is the dangerous fat. And they tend to do that more than the women do because the women tend to carry it around their hips and thighs. The central fat that men carry is much more liable to result in what we call the metabolic complications of being overweight. Insulin resistance, type 2 diabetes, high blood pressure, raised cholesterol levels. So men are actually more prone to developing those risk factors, and as a consequence they're more liable, as we know, to have a heart attack. Women do get heart disease, but in general about 10 years later than men. So it's very important that men recognize that they have this problem and that they should try and do something about it. And in circumstances where conventional diets haven't worked, then surgical weight loss is a good option. Our experience with men and weight loss surgery has been very good. They tend to do well. They tend to do actually well with all the procedures. And I'm quite sure that in the near future we're going to see more and more men presenting themselves as candidates for surgery.